I would greatly appreciate it. Welcome, everyone. Thank you for joining us today. My name is Ginny. I am the Executive Director of the American School Health Association. I'm so thankful that you're here with us today. I'm just going to share my screen so you can see my slides here. One moment. So I'm noticing some familiar names in our participant list today, so I'm so thankful that you joined us today. Just a moment to tell you a little bit about who we are. The American School Health Association is a professional membership organization, and our mission is to transform all schools into places where every student learns and thrives. And we envision healthy students who learn and achieve in safe and healthy environments and are nurtured by caring adults and function within a coordinated school and community support system. I want to let you know about our upcoming conference, our 93rd Annual School Health Conference, which will be taking place October 2nd through the 4th in Cincinnati, Ohio. So we hope that you all will join us there and learn even more than you ever hoped to learn about school health. So we hope to see you there. Just a little bit about ASHA and the benefits of membership. As a member, you receive a copy of the Journal of School Health, which is our peer-reviewed indexed professional journal. You can either get that in print or you can get that online, so there are both options available to you. You're also connected to wonderful information and expertise through our annual conference, our bi-weekly newsletter, and our networking communities as well. You're really joining a community when you join ASHA. Also, we offer continuing education, and our members receive free continuing education units for things like our conference, as well as webinars like this today. We also have a career center, and we have discounts for members on job postings within our career center. Our career center also offers an opportunity to post and for interns to look for internships, which is a wonderful feature that I hope you'll check out. And also members receive a 15% discount on all American Academy of Pediatrics publications. So please consider joining and taking advantage of those benefits. I'm so pleased to introduce you today to our presenter, Ginny Black. Ginny has been a school nurse for 20 years. She works in a major urban district with a diverse student body with a wide variety of needs, and one of those is oral health. Currently, Ms. Black serves on the board of Oral Health Ohio. This organization is working with licensed school nurses in Northwest Ohio to improve their practice and referral sources. In her role as a school nurse, she is responsible for the healthcare needs of students and staff in the schools she works. This includes oral care, individual care, as well as collaborations with sealant providers and mobile units. Ginny served on the National Sealant Work Group and the Children's Dental Health Project. And we're so happy to have Ginny here today to tell us a little bit more about what she does. And I'll turn it over to you, Ginny, and I'm gonna get your slides up and you just tell me when you wanna change your slide, okay?
I wanna welcome you all today. And I do want to put a push in for their national conference. I am from Ohio, and Cincinnati is a wonderful city. So, but we're here to talk about oral health and what we can do in schools so that kids get the best benefit. And I do want to talk about our long-term goal is for kids to have good teeth structure and healthy mouths until they die. And I tell the kids that once they get their permanent teeth, they have to keep them nice till they're 90. And that we have to start when they're young, give them the knowledge they need and the work that needs done on them so that we can achieve that. So what we're looking at is giving kids and adults a good quality of life from birth to death. And over the short term, we're looking at being in schools, having kids with healthy teeth and healthy mouths in schools so that they're able to learn. And secondly, we want them to learn how to take care of their oral health needs themselves, and to be able, in a lot of cases, to bring new information to their parents so that their parents know how oral health has changed since they were a kid. Slide, please. So we know that poor oral health can have a detrimental effect on children's quality of life, their performance at school, and their success later in life. And so we have to start young. I want to say that over the last 5 years, we have started dental visits at age 1, where the dentist can look at the teeth and can do a lot of teaching to parents, and so that the parents understand what they can do so their kids' teeth are healthier earlier. So that passes on into preschool, where we have Healthy Start, and we can work with both parents and kids to establish healthy habits. And when kids have problems with their teeth, we can take care of that early. We know that parents who have poor oral health habits have kids with poor oral health. We know that kids whose early teeth have problems with their permanent teeth. So by starting early and working with schools, we can improve that oral health that will last a lifetime. Slide. Okay, tooth decay is preventable, and ensuring that students have the preventable oral health services they need in school is important in helping them stay healthy and ready to learn. And that goes down to knowing your population. Nurses talk about evidence-based practice in this way. We look at the research that helps us look at the area of oral health and what can be done. We look at the population we have. That would be doing a nice needs assessment. And then we look at the experience we have with that population over time, so that using those 3, we can set up a plan and evaluate it and amend it so that it is most effective. So as we look at those things, that's where I'm coming from. Okay, slide. Poor oral health is associated with increased absenteeism and poor test scores. And when you are working in schools, I believe you have to speak their language. And right now, absenteeism and having children absent means they can't learn, and they obviously test worse. Along with that, having pain impedes your ability to learn, and that affects your test scores. So I think the argument can be made that we can improve the school climate by introducing oral health in more than one way and helping teachers and administrators to see that value. So if you're looking at this on the left-hand side of your screen, you'll see that 20% of children have decay at some time. 1 in 7 adolescents have at least one untreated decayed tooth, and those are permanent teeth that will affect them their whole life. And that the social determinants have a huge effect on this. And as we get into this, we're looking more and more at doing risk assessments early in life on individuals to see what social determinants they have and how we can mediate those barriers so that this child can have a healthy mouth earlier. And obviously that would translate into them doing better in school. Slide. Okay, so I want to say that 1 in 14 between the ages of 5 and 14 have a dental injury also. And those can be pretty serious. They can lose teeth. We need to have staff know how to take care of emergencies, but also we want to be preventative and look at the factors in the school environment that cause those injuries and change them. So this is a team approach. You have to engage teachers, community, outside agencies, and the people you have within the school, phys ed, people on the playground to help prevent those. Slide. We can go then, okay. So I think it's important to look at what we're looking at nationally. And as we look at Healthy People 220, and we're looking at a lot of the same goals to get people in a position where they have healthier mouths and learn better. And if you look at the 13-14 data, you can see that we have quite a large percentage of the population that has dental caries and therefore are at risk for problems as a result. So I want to say that the pain as a result of these can affect sleep, it can affect learning, and it can affect the way they interact with others because of irritability. And so by fixing those teeth and giving people healthy mouths, we improve the quality of life and also the quality of the atmosphere at the school. So we can go on to the next slide. Okay, so what do we know that where we can look at how to fit oral health into the schools? And so the whole school, whole community, whole child model shows us how we can implement that. I have given you links at the end where you can go and learn more about it. Obviously, if you look at it, you're looking at the center, and most of you have probably seen this, and that the components you look at in the school community to make kids healthy, safe, engaged, supported, and challenged. Next slide. So this model has 10 components. It's comprehensive. We want to look at, when we look at these, we want to look at policies, the evidence-based practice and best practices, and we want to look at how we can work as a team. I like to think the sum of the parts is better than the individual components. So how do we work as a team to make this better? And so I'm going to look at how oral health fits into these components. Next slide. Okay, so the first slide has to do with physical education and physical activity. And I want to take the long-range view of this. In schools, we want phys ed. We want more physical activity. We know that that builds healthier kids and kids with better test scores and kids that do better socially. It also improves oral health. Oral health is intricately related to physical health, and lifelong physical activity decreases chronic disease. If you look at the left side of your screen, you'll look at there are associations between oral health and a number of chronic diseases. And I don't want to say pregnancy is a chronic disease, but we do get more low birth weight and premature births as a result of it. And in the school environment, we have the ability to work with that because we have pregnant teens. Adults can look at their oral health before they conceive. They can have a healthy mouth that contribute to a healthy baby. But teens that get pregnant generally are not planning to. And we as school personnel can make sure that they get in evidence-based programs where oral health has a component. And by improving their dental health and healthy mouths before they deliver, then we get better outcomes at birth. And we know low birth weight and premature births are associated with learning issues later on. And so we actually do improve the kids as they come into school in 5 or 10 years. So I believe that we want to instill into kids habits that promote physical activity throughout their lifespan. So phys ed is fun. I encourage also phys ed breaks in between activities in the classroom, and I encourage them to try different activities after school. We also want to promote the use of personal and protective equipment, which improves oral health. In other words, we want to have safe playgrounds, we want to have safe gymnasiums, and we want them to wear the mouth guards and the helmets that they need to. So go on to the next slide. Okay, so nutrition. Well, this is a cyclic approach. If you don't have good teeth, you can't eat the things you need to have your healthy teeth. You can't eat the things you need to have a healthy body. And it hurts. So good nutrition also promotes healthy teeth and oral health because we can build, especially as kids, we can build the structures that build healthy teeth for a lifespan. We know that kids now are not getting as much calcium as they'd like. Now, so we want to promote milk at meals. We also want to promote kids with lactose intolerance drink lactose-free milk. And that is available out there, and it does have a good amount of calcium in it. And schools can provide that as a healthy alternative. So we want our lunch programs to have fresh fruits, fresh vegetables to fit the new, I just say Michelle Obama model. We'd like to see kids buy into those healthy lunches. We want them to try new things 2 or 3 times. We want them to try new fruits and vegetables as snacks. I am a real proponent of the school garden program. I think kids eat what they grow. And when they start to see the variety and what they can do, I think it makes their meals healthier. And I think they can teach their parents how to do that also. So we want them to drink water first for thirst, and we want that water to be fluoridated. So we want to look at tap water. If you have, if you've been in a major airport lately and you have to carry an empty water bottle, you notice the new water fountains they've installed on the other side, and they have spigots as well as water fountains. And I would like to see those installed in more schools because we'll have kids drinking more water, and it's fluoridated because it's tap water. One of the best practices is Delta Dental has had a grant out in the past couple years where they worked with schools to install those drinking fountains, and they've seen an increase in kids drinking tap water. So, like I said, water fountains with faucets. We want to see healthy snack and vending machine practices. The district I work for, which is Columbus City Schools, has a water-only vending system. We want kids to drink the things that are healthy for them. We want them to drink water instead of Gatorade. They've been told that if they're out there exercising, that they need these drinks to keep them healthy. But in reality, unless you have exercised hard and solid for over an hour, you should be drinking water. So you can also look at healthy snacks in your vending machines. There are many different ways to do it, and the federal government has a formula that you can look at. We want to see healthy party practices. We want people to bring in healthy food if they're going to bring in food. We'd like to see them look at bringing in pencils or other things for birthdays. But a lot of times when parents are low income, what they have is the ability to bring in food. And so if we can get them to bring in fruits or to bring in smaller cupcakes and then veggies with them. And we want to give both nutrition education to kids as well as parents. We have a healthy immigrant community in both large cities and small towns. And those people come in with perceptions of nutrition in their cultures. Some of them are healthy, some of them are healthier than ours, and then some practices are not going to be. So we want both kids and parents to learn what they need for healthy teeth. Next slide, please. So I want to talk about health education. Obviously, we have HECAT, and we want to look at those standards. I want to say that there are definitely a lot of different ways to go about education. I like to take the positive approach. I like the approach where we have kids aim for a healthy mouth, and what choices can they make to do that, and what skills do they need to make those choices, versus, well, I saw a math education program recently where they told kids that it could damage their oral health, don't do it, and then they showed a picture of a mouth that was, I would say 90% full of bombed out teeth. So I want to promote healthy lifestyles when we're talking about tobacco, drug, and alcohol education. I want personal practices where kids make healthy choices. I want them to make health goals that they can meet. In this case, I want oral health goals. I want them to make healthy nutrition. I want them to learn the best practices of oral health, and I want them to teach those to their parents. So some of our immigrant kids have come from camps where they don't have indoor plumbing, and so where they don't have doctors, so they don't have dentists either. And in fact, they're going to worry about their hearts before they're going to worry about their teeth. So when they come to this country, we want them to understand what we consider good care and how they have access to systems where their kids' teeth can be healthy and their teeth can be healthy. And I think that a lot of times those kids can model practices for their parents that they learn in school. They can model nutrition. Now, I'm honest, most kids eat what their parents put in front of them. But when it gets time for them to make their own choices, and when it gets time for them to cook for their kids, we hope that they'll choose what we teach them today. So I want them to know the best science. I want them to understand the anatomy and the physiology. I want them to understand public health and how we as a nation can help people keep their teeth healthy and their mouths healthy. And then I want them to learn personal health. I think it takes education by the student, family, and community all together to build a good system. I want the kids and their parents to know what trusted websites and resources are available so that we can promote good and healthy practices, not just in oral health. And I want comprehensive education, pre-K through 12, and I want it at the developmental age of the child, and I want it to build. So next slide. I think that is probably old hat to most of you. So we know what an effective education curriculum is, but I believe that we can give kids a good basis through a curriculum, but I also believe in teachable moments. And if we ourselves have a good information base, when that kid comes and his tooth's hanging out, or a kid comes and points at something, then we can teach them what to do. I think that we have the ability to shape those personal values and beliefs positively. And we have the ability for this generation to have different norms that reflect a healthy lifestyle. And then obviously we need them to have the skills to take care of themselves. Next slide. Okay, so the social and emotional school climate. In Ohio, this has become one of the 4 pillars of education as of this year. So we want to have a climate accepting of individual needs and good personal habits, and those include oral habits. We want a climate that encourages care of the whole child. So we want to look at the risks. We want to give them the skills to overcome barriers, not just for the child, but for the family. We want to provide that care where the child can get it. So if a parent's working 3 jobs, getting that care at school is a possibility. And a climate that promotes skill sets and establishment of good oral habits in the school setting. At this point, I know we brush teeth at Head Start. It has been difficult to integrate it into more of the school climate. So, but I do want us to keep in mind that having a toothbrush at school and the ability to do it there is the ultimate goal. And maybe we can do small things along the way that will improve what we've got already. Or perhaps we can provide that toothbrush for high-risk kids. But we want them to establish as many good oral habits as possible in the school setting. And that might also be, we want them to, we want them to drink water after their meal, swish it around, swallow. We want to make sure that if they're using inhalers that they're rinsing out afterwards. We want them to understand what good nutrition is. We want them to understand how often someone should go to the dentist. Next slide. I would say with that one also, this fits in with ACEs, and a lot of kids that are from poor socioeconomic areas also have experienced trauma, and taking a positive approach with them and using the skills we use with kids with trauma is definitely going to encourage them to use the skills we teach them. So the physical environment. We want a safe playground in campus. So we want safe spaces underneath playground equipment. An organized playground is a safer playground. Now, I realize that staffing can be difficult to have an organized playground, but the more organized we can make it, and again, it's baby steps, the more safe it is for the kids there, and the less injuries, oral and otherwise, we're going to have. So we want safe play. We want kids to understand what their limits and boundaries are so that they can keep themselves and other kids from having injuries. We want our environments tobacco and drug-free. And I will add to that vape-free. So we want them to be in an area that is free of the things that they could breathe in that could cause issues. I like to tell my kids that everything that goes in their mouth contributes to their healthy or unhealthy body. In other words, if you eat an apple, it's going to have a positive effect both on your body and your teeth. But there's going to come a time when you make a choice to have a cupcake. We hope that that's not your meal, breakfast, lunch, and dinner. But if you do, then you understand the consequences. So we need kids to understand that smoking is a choice, that they don't have to do it, and that when they do smoke, they affect their body negatively, and they definitely affect their mouth negatively. And and that goes with chewing, vaping, meth, and drug users, because they don't take care of themselves, have awful oral health. And then we want a safe climate, that social and emotional climate where a child feels mentally and spiritually safe. If you don't feel mentally and spiritually safe, then you can't live in a stress-free environment. Without that stress-free environment, you really can't learn to your capacity. So, next slide. I want to talk about employee wellness. We do have an employee wellness program. I think that staff needs to understand how to take care of themselves and their family. They need to understand how oral health changes, what the things they can do to keep their mouths healthy. We need to have smoking cessation programs and drug education programs for staff. People make choices, and then they can make choices to become healthier. The gold standard is a dental home with regular care, with a dentist who knows you. That's not always possible. So if you can help them establish that. If not, if you can help them find a place where they can go every 6 months and get the care. And if they haven't gotten any care, perhaps they will go for the first time. I have several teachers, they have good insurance, who were unable to get braces as a child and now are taking care of that need as an adult. We want to make sure insurance is provided for oral care, and that goes for both staff and students. You can't have good physical health without good oral health. We want to promote role modeling. None of us is perfect, but we can take the things that we do the best and show others. We want to teach and promote good nutrition. I can honestly say that I have done baby steps with this. I went from leaving my building and eating out to freezer meals. And then I decided that I needed to show what was important as far as what was good nutrition. And so now I pack a lunch. I try and eat it with teachers so that they can see what a healthy lunch is. We want to teach about healthy beverages and promote water bottles. And by that, I mean water bottles that we refill with tap water in school. And then teachers become role models for students. We talked about drug and alcohol treatment and tobacco cessation. I believe that along with employees, we need to be able to channel family members into these when they're needed. Often, faculty and coaches don't understand when mouth guards, helmets, bike helmets are needed and how essentially important they are in preserving a quality of life over a lifetime. And then we want people to know what to do if they have a dental emergency, where to go, how to preserve a tooth. Next slide. I think community involvement is essential in any program. Information and programs change over time. Community involvement is essential in bringing the best and practices to schools. So, fluoridated water and non-leaded water, and topical fluoride application programs. School-based health centers. I want to say that in school-based health centers, one of the really nice models is in Cincinnati, where they're having their annual conference. At the Oilers School, they have an integrated model with medical and dental. And at the schools, they've only been able to put school-based health centers in. They have taken students who needed dental care and gotten them to dental centers. Dental mobile units. I do want to say that we want that dental homes are the gold standard. But like I said, not every parent is going to get their child to a dental home. So having dental mobile units that can give complete care are essential. I would look at your insurance system and your Medicaid systems and see how the payment is out. In some situations, if the mobile units only provide preventative care, then parents get a double charge for an oral health assessment if they then get the restorative care somewhere else. So we want to make a fluid model where parents have to pay the least and get the best care. Ohio State and Case both have dental mobile units that give complete care. And Summit County in Ohio also, and I've heard that there are vans in Kentucky and across the country. Like I said, a dental home is the gold standard. And if at all possible, that's what we want to aim for, helping our students and our families and our staff find places where they get the best care in their own community setting. Advocacy for dental insurance that covers the needs of children and staff and the community. We know that if parents have good dental health, kids have better dental health. So, but we also know that there are an increasing number of kids with special needs and chronic diseases, and that oral health feeds into how well those kids are doing. So they need both insurance for physical health and dental health. Dental sealant programs. I tend to believe they're the best bang for your buck when you're looking at preventative community programs. Working with the folks that come into the schools, they can bring portable equipment, and that portable equipment makes it possible for you to seal the teeth of students. And if you're not familiar with dental sealants, they're put on the molars to even out the surfaces, and that prevents caries. They have an 80 to 90% success rate over a year. It goes down over time, so you do want to have them rechecked. Supportive tobacco cessation programs, and drug treatment programs for teens and younger. I mean, we would be naive to think that these problems don't exist in our schools, and giving kids choices to change their unhealthy habits are smart. And then support for programs that reduce unintentional dental injuries in sports and PE programs. And I think a lot of times we have big health fairs and we don't include oral health. I think it is a great opportunity to teach kids, or in high schools where we have dental hygiene programs in the vocational education area, having those kids come work with the elementary kids in the schools they came from is a great opportunity for both people. Next slide. Kids come from families, come from communities. I like to teach in a way that involves the family. So if a child sees a presentation at school, then they carry something home so that their parent can see what they learned. Or the parent's invited to be a part of the classroom when there's something going on. To include family and school health activities. Have parents help during field day. Have parents help if we have a school health fair. I want to add that when we work with families, we want to consider health literacy and culturally appropriate approaches. In the city I live in, we have the second largest Somali population in the country, and many of them are illiterate in 2 languages. Now, their kids can help them, but we also need to have interpreters who can speak to them so that they understand the concepts. And then culturally appropriate approaches. We also have a huge Nepali population, so understanding the nuances of their approach to life and being able to work with that. And every family is different. They belong to a community, they belong to a culture, but they also create their own. And figuring out what's important to that family often can help us make a difference. So Educate Family is about what current recommendations are for dental care. The biggest one that families don't know about that I've found is that you want to get that child into the dentist at age 1 so that we can do some teaching and we can evaluate the family for risks and get the care that will give them healthy mouths for a lifetime. And then I want to encourage vaccinations for HPV. HPV is now given at age 8, 2 shots over 6 months. Historically, we have thought about it for cervical cancer. It started out only being given to females. Now we give it to both sexes because that HPV can be passed through saliva. And we have an increasing number of oral cancers appearing in the 20s and 30s, more for male than female. And the implications of oral cancers on the quality of life are huge. And they can and a lot of those can be prevented. The majority of HPV cancers are throat and tongue cancers. And so being able to give preventative shots that will eliminate the risk is huge. So, next slide. Providing families with websites and resources for trusted information. A lot of teachers use websites and contact sites for parents, and being able to put information on those sites so that parents can look at what we're teaching their kids and can also become involved and understand what they need to do themselves. Include families in oral health safety programs, and looking at places where they can get mouth guards and helmets free. Provide information and referral for appropriate care. Help families to understand and provide nutrition for their children, and encourage the whole family to seek dental care. With nutrition, often being able to use a nonprofit in the community. We have a nonprofit that works with people on SNAP or food stamps, and what they've taught them is how to work a grocery store, get the most for your buck, and still give your child a healthy diet month long. And one of their offerings recently was a tour of the grocery store, and then they were able to give the families $10 vouchers to go and buy food for a healthy meal that might last a meal or two. And along with that, they taught them a good bit about nutrition as a family. Encourage the whole family to seek dental care. Next slide. Well, before that, I would like to touch on the role of school nurses. I am a school nurse. School nurses have the ability to screen kids for oral issues. They have the ability to help parents find providers who can help when their child has a dental emergency. They can help parents. They can help parents get the best care for their kids. They can also act as a resource for teachers so that teachers have the most up-to-date information. The American Pediatric Association view is that there should be a nurse in every school. Licensed school nurses in many states have both an educational license that mirrors their registered nurse license. And so it's a mirror between education and health. And they are the health resource in their school, and they can help teachers plan programs that perhaps are step by step, so that we see a kid from the time they enter the school to the time they leave, and we can help them grow grade by grade so that they get the skills that they need. And this is a quote that I hold dear to my heart. It's from Jocelyn Elder, who was Surgeon General. I feel that we can't educate children who are not healthy, and we can't keep them healthy if they're not educated. There has to be a marriage between health and education. And I think PE and health education teachers are a godsend for that. Along with all of the other components, we work together to make a team and give a child a healthy mouth from birth to death. So I am, next slide, and I think that is the last slide. I want to thank you. I want to give you resources. If you would, the first one is 2 or 3 pages, summarizes the information on oral health and learning. The second one was done by the Association of State and Tutorial Dental Directors, and they also use this model, and it's a little more in depth about how to coordinate oral health with school health programs. The ones below have to do with the model, the whole child model, the healthy schools model, and some information on oral health. The last one is a link to the school health index. When we're working with communities, it is always great to have a wellness committee made up of school staff, community members, parents, the nurse, and the school health index helps you work through what is great in your school and what needs improvement, and then what areas you're able to make a difference in. Questions?
Yes, thank you so much. This has been terrific, and I'm so thankful that you kind of went through each component of the WISC model and talked about how each of those components can be thinking about oral health. I think that's really, really important. I invite each of you to take a moment and type your question in the chat box, and we can pick Ginny's brain a little bit while we have her here. So I'll give you a moment to type your questions directly into the chat box.
Apologize. I did not put my contact information on the slides, but you have it, and perhaps you could add it as the last slide. I am happy to entertain questions by email or by text, for that matter, and hopefully I can give you the information you need when you're thinking about this 3, 6, 9 months from now.
Great. Yeah, if anyone has any questions, they can always reach out to Asha. We can put you in touch with her, and that would be terrific. So someone asked whether we would be able to get a copy of the slides. We typically post those along with a recording of the webinar, so you can watch it at a later date or kind of go back and forth and find the information you're looking for. Elizabeth asked, Ginny, what is an organized playground?
Okay, so an organized playground is essentially where you would organize it into activities. One example is, say you have a hopscotch in one area, jump roping in another, basketball in another, and either the kids are grouped in those different activities, or they rotate between them. It keeps the groups smaller.
Mm-hmm.
It gives the kids a chance to learn teamwork.
Mm-hmm.
There is not an overload on the playground equipment. And kids learn, and it gives the kids the ability to learn different skills or exercise different muscle groups. And the kids I've talked to who've gone to organized playgrounds actually have a whole lot more fun at recess.
Oh, that's great. Any other? Oof. Okay. In the interest of time, I just want to let you all know that we have some upcoming webinars. We have one on melanoma. We are also having an ASHA virtual town hall around our efforts in becoming a more diverse organization. In April, we're also going to be doing we're going to have a presentation about Catch My Breath. And then, oh boy, April is a busy month. We're also talking about publishing in the Journal on School Health. So we hope that you'll join us for some of those as well. If any of those are of interest to you, I want to remind you that this webinar is eligible for 1 continuing education hour from CHES or MCHES if you are a member of NCHEC. It's also eligible for a CNE. And you could also get a participation certificate as well. Let's say you belong to a different type of organization or you need a certification from a different organization, you can take that participation certificate and submit it for your other certifications. As I said before, members receive free continuing education. Non-members may purchase theirs for $30 per hour. And CEs can be obtained by completing the webinar evaluation that we will put a link, oh, there it is, in the chat box. You can click on that link, complete that, and we'll get your continuing education processed.
Yeah, and I am interested in feedback. So how do I make this presentation better? How do I give you the information you need?
Terrific. Thank you, Ginny. Just another reminder for our upcoming conference in Cincinnati. Ginny's done a great job of kind of highlighting the great work that's being done in Ohio, and I agree that school-based health centers in the Cincinnati area are terrific, and we're working with them to try to incorporate their work into our conference as well, and kind of highlighting that. So we hope you'll join us. I want to thank you, Ginny, so sincerely for your time today and the wonderful information. I'm so thankful that you were able to join us, and I'm glad that you all were able to join us as well. And we hope to see you at another webinar. So thank you all. Have a terrific day.